My name is Álvaro Martínez Petit, and I am a recent graduate in Biomedical Engineering by the Universidad Politécnica de Madrid. I am doing this video to share with you the topic of my final degree project, so you can see how it can meet patient needs and help them to overcome their disease. But first, let's talk about the problem that needs to be addressed. Chronic diseases are those that are suffered for a long period of time. There is neither a cure nor a vaccine for them, and they can't be transmitted from one person to another. These kind of diseases are known for its inevitable progression over time, and they are quite extended over the population. As a proof of this, here we can see a recent piece of news from the journal La Razón, where the spotlight is put on the high percentage of people with chronic conditions that require medical assistance. In another piece of news from the web portal InfoSalud, it is stated that there exists a problem with treatment adherence in chronic conditions, which could be solved by improving the knowledge of the patient about their illness. It is in this area where my final degree project focuses on. I developed a recommendation system of personalized clinical advice for people suffering from chronic diseases. Being more specific, it consists of a software layer with the purpose of generating recommendations. It needs the patient to provide information about them and their disease conditions, and in return, the patient receives advice about different aspects of their disease, in the form of short videos or little pieces of text. It can be easily integrated in a mobile or web application. The recommendation system that I propose can effectively help people to know more about their details of their disease, which brings many benefits for them. Understanding how medication works can improve adherence to treatment, knowing about the causes of the disease lead to better life quality, being conscious of the symptoms of the disease crisis and knowing how to handle different situations empower the patient, and acquiring a global understanding of the disease bring people closer to be expert patients that not only know how to take care of themselves, but also help other patients. The viability of this idea has been demonstrated in my final degree project using data from a cohort of 51 patients who suffered from migraine from the University Hospital La Princesa, inside clinical research. Migraine is a chronic disease characterized by episodes of acute headache that incapacitates people who suffer from it for some period of time. There exist known triggers and symptoms of these episodes, but their appearance varies from one individual to another. I specified the implementation details of the recommendation system for migraine disease. In general terms, the software contains two different working phases. In the first one, the data provided by the patient that in migraine disease included symptoms, triggers, and pain intensity of episodes is used to categorize them in one of the different clusters of patients with similar needs. In the second one, a neural network-based algorithm takes all the available advice to provide and rank them according to the characteristic of previous migraine episodes and to the cluster the patient belongs to. This algorithm has been trained following clinical criteria for advice ranking of professionals from the University Hospital La Princesa. It is true that there exist other solutions with the purpose of keeping patients informed of health-related issues, but all of them lack some important aspect. The recommendation system that I developed in my final degree project is disease-specific, as it is centered in a particular chronic disease, and employs users' historic data, which are the weak points of HealthRec-SIS, a powerful recommendation algorithm for general health habits. Furthermore, my recommendation system can be adapted for other diseases apart from migraine, but unlike Migraine Buddy, one of the most popular mobile apps for migraine, it can provide personalized advice for each user, adapted to their needs. I hope this brief talk have been enough to show you all the benefits that a recommender system like the one I just presented you can have for patients of chronic diseases. Goodbye, and thank you for listening.